Hi, folks. Welcome back to episode 70. Thanks for joining us today on our podcast. And today we're going to talk about the so exciting UTIs. I wanted to bring this up because I'm having more women who are coming and asking for help with reoccurring UTIs. And the standard of care, if you get a UTI, urinary tract infection, right, is to take an antibiotic. And then that antibiotic does not just affect your urinary tract bugs, but also systemically, right, your microbiome in your gut as well. And so then we know, right, that chronic antibiotic use can lead to things like yeast infections that can also lead to a poor gut health. And so usually by the time they get to poor gut health, that's when they're coming to me because I know that our gut health is important. And so I'm always trying to figure out what that root cause is. And they're like, oh, well, I have to take an antibiotic every month because I'm getting these UTIs. So it's like, all right, let's back up a little bit and figure out why women are getting chronic UTIs every month, right? Every other month. If it's more than 3 or 4 times a year, you're getting a urinary tract infection, something's up. Right?
Yeah, like 2 things here. Quit wiping back to front and quit wearing your stupid thong because it's pulling feces towards your vagina.
Exactly. So there's a couple of things. So not only, so that would be like the exposure, right? The most common bacteria that causes UTIs is E. coli, right? That's coming from the stool. It's coming from the anus. And so we've got to be careful of that. You don't see UTIs in men that often because there's more
The distance
area.
between those 2 openings are a lot, hopefully for the women, is much larger.
A lot further. Yeah, so the bacteria has to go a lot further. So it's a lot less likely for men than it is for women. So we have to be very conscious of that. The other thing this throws out there is that it's not just the introduction of E. coli from the gut health, right? But also when we talk about the microbiome, those are the bugs that live in and on our skin. Our vaginal vault has a whole host of bacteria within the microbiome, right? And usually the environment of the vaginal vault is usually a higher pH. It's usually a little bit more acidic. So the bugs and the bacteria that live in that area that keep that area healthy are pH loving bacteria, right? So if we have a tendency to over clean or like to douche with some products because have been taught that there has to be a level of cleanliness, right? And if there's an odor, right, people think that there's something wrong. And it's really the bacteria that is producing that odor. But so people will overly clean and they'll kind of like sterilize the area, if you will.
I think we should be very specific on that, like, because people, like, clear, like, we are not supposed to use soap on our vagina.
Right. Our vagina is self-cleaning, right? Like
water only, right? Like you just use water only to get in those cracks and crevices.
Yes. Yeah. People will use, like antibacterial soap or body wash. And so that changes and disrupts that bacteria in the environment. Right. So people will think like body wash is safe. Well, you can choose to use body wash, right? But you don't want to use it in the groin area, right? I mean, we need.
I never thought of this before you and I don't know, probably like a year and a half ago. Like I never thought about it, but the analogy just came to my mind. I would never take body wash and wash my mouth or my nose with it.
Yeah.
Why in the heck would I be using body wash down there in another opening?
Yeah.
I just never thought of it.
Yeah, well, it changes the environment. A lot of people don't think about it, right? And sometimes if they have a tendency like to have vaginal itching, right? They'll think that it's because there is an infection or and then some body washes they may have heard, okay, don't use body wash, but then they may change to something like baby shampoo, right? I've been seeing people are using things like baby shampoo. It's still soap
with perfume in it typically, or other fragrances.
Yeah, it's. I mean, technically, it's hypoallergenic. That's why you can put it on babies and it won't cause tears if it gets the shampoo in their eyes. But it's still a soap, right? Yeah. So it's better to not use that in the groin area.
Can you
And
use it on the backside? Sorry, I keep interrupting you.
that's okay.
Like nobody ever taught that stuff, and people aren't willing to have this like very blunt, very just transparent conversation.
Yeah.
So
Yeah.
can you use soap on the backside, or you're saying no soap, front or back, no soap?
No, just water, right? Just
Okay.
use water. I mean, both of those openings or orifices, like they are self-cleaning, self-eliminating. I mean, you have to wipe, right? And for some people who have who don't who may have bowel movements, may be towards the constipation or more towards like loose stools, right? They might have a little bit more residual stool after evacuation. So yeah, definitely wipe adequately, but we don't need soap there.
Okay.
No. Yeah. And yes, so there's things that we can do to also promote the natural bacteria, right, and the environment of the groin area, right, vaginal vault, the anus, and a lot of that it kind of stems from our food. If we're eating a lot of processed food, a lot of simple sugars, we're changing the environment, not just in our gut, but also within the vaginal vault. So what I see is if people eat a lot of sugars, right? If they do a lot of sweets, not just the simple carbohydrates, but just a lot of like sweets in general, right? Candies, sugars, cakes, donuts, sugar in their coffee, you name it, that changes the environment, and people have a tendency to have more yeast infections as a result of that, because they're getting sort of systemic candida, and then it presents as a vaginal candida, right? So like a yeast infection. If people have that change in that pH because they're eating more sugar and it's changing the bacteria, they're going to be more susceptible to UTIs.
Okay.
Yeah. So most folks, who are having those recurring UTIs, if we clean up the diet, cut out those sugars, right? You've got to change the pH. We need to be a more acidic pH, and it needs to be a natural pH, not just more acidic because now all of a sudden you're douching with, pH balancing products, right? A lot of I didn't think people use douche anymore, but apparently people they still sell it in the stores, so they're still using it. I was kind of big in the 80s, and so I guess I don't know. People are still learning that. So, and it'll say it's pH balancing, right, to help to promote that acidic environment. But it's just putting a Band-Aid on the situation. We have to correct the terrain. Now, now sometimes it can be a little bit tricky, but people who have recurring UTIs often know what those symptoms are like for them. Okay, so usually the textbook UTI picture will be increased frequency, burning with urination, right? Maybe like a bladder fullness sensation, usually did I say pain with urination?
Mhm.
Yeah. It may be a level of incontinence that they hadn't had before. Yeah, because I mean, it's a bacteria imbalance, right? And so it's creating those symptoms. Now, for some folks who've had reoccurring UTIs, they may not get that pain with burning anymore, but they still may get the increased frequency. They may notice a change in the smell of the urine, right? Sometimes sometimes our urine changes the smell depending on what we've eaten. But if all of a sudden it changes to this like really weird smell that you're like, oh, hey, something's not right. I tell people you got to pay attention to those signs, right? Or those symptoms. Because that's giving you the evidence of, hey, what can I do? Or I can do something now to change this instead of waiting it to turn into a full-blown infection and then have to be on antibiotics.
Do you think that the conventional medical community, when people come in with a UTI, is it standard practice to test them for, and it's not called STDs now, it's called something.
STIs?
Yes.
No.
Because those are, you can have the same of symptoms if you have an STI.
Yes.
Like chlamydia. The symptoms are very similar.
Yes. Unless there's something in the story or in the history that may be suggestive, right? They may ask, how many sexual partners do you have? Or are you sexually active? How many sexual partners do you have? Are they same sex or opposite sex partners? And so if in that history they get a feel that there is a possibility of an STI, then they will run that lab. But that's usually not like not always the first line, right? It kind of depends on sort of how complex the case is.
That's interesting, because isn't the statistics now it's either 1 in 2 or 1 in 3 people have STIs?
Yes. It's going up drastically.
You would think it would become standard practice. Like, well, let's see if this really is a UTI or if this is an STI.
So UTIs are really easy to diagnose in the office because you pee in a cup, right? And they can do a dipstick and they can look and say, okay, oftentimes that's what they'll do, at least in private practices, right? And that's something that they can come up with those results very quickly, within 3 minutes. You can have those results. And so even if you're going to a doctor's office that has a lab attached or urgent care, right, or something like that, they can get that diagnosis within 3 minutes, send you on your way with antibiotics. Now, if it comes back negative and you're experiencing those symptoms, that's when they will take that next step and try to rule it out with, STI screenings and other things. Yeah. So they tried to identify the most obvious first.
Okay.
So, and then, and usually the other thing is that, so they get that diagnosis within 3 minutes, and the strip doesn't tell you what bacteria is causing the infection. Okay. All it says is, hey, there's bacteria present, or hey, there's white blood cells, or your immune system is fighting off something. And so based on that, they give you a prescription. Now, if that prescription doesn't help, that's when they will go a little bit further, right? They may take another urine sample, and then they will start to grow it and do what they call a culture and sensitivity to identify and say, okay, is it a different bacteria than E. coli that we didn't expect? Or is it, and what in a specific antibiotics it's reactive to or sensitive to. And so sometimes when, if folks have a history, I always inform them and tell them, ask your doctor to do a culture and sensitivity every time you pee in a cup and you do a UA. If you suspect it's a UTI and you've had them in the past, okay? Because there are other bacteria that can cause UTIs, and sometimes those antibiotics are not as helpful. And that's where sometimes natural things can be helpful to prevent UTIs, or you can catch it early before it turns into a full-blown urinary tract infection. The other component is that if you suspect you have a UTI and you don't want to go to the doctor and get that diagnosis, it's going to be important to do something. okay? Because the trick is with UTIs is that usually it starts in the urethra, right? That's where the urine exits the body.
Okay.
Then if it doesn't, from the urethra, it goes up and then opens into the bladder, right? So if you don't address it in some form or fashion, when the infection's in the urethra, it can go up to the bladder. If you don't address it, then it can go up to the ureters and it can affect the kidneys, right? When we get a kidney infection, that is very bad news. Mm-hmm. So I'm going to encourage people to do something, whether that is to get an antibiotic or whether that's to get natural things on board, and not let it progress to the kidneys, because a UTI by itself is not entirely benign. But I wanted to bring it up today because reoccurring UTIs is a symptom or a sign of something something bigger. Yeah. So
what is a primary, like, what can they do to prevent them? What are the three things, or the whatever, however many things? Like, you shouldn't even be to a place of like having to treat them. Like, I literally have never had a UTI in my life.
Oh, that's fantastic. Good. So the things to avoid getting UTIs, especially if you have a tendency to have them, is definitely address the diet, right? You've got to reduce the sugars. You've got to get the yeast under control. That systemic candida under control. Mm-hmm. We already yes. The other one that maybe people have heard of, usually we've been told like, hey, try cranberry juice, right? Cranberry juice helps with UTIs. The reason it helps is because cranberries are very high in an amino acid called mannose. There's two different forms of mannose. There's L-mannose and D-mannose. D-mannose in supplement form inhibits the E. coli from attaching to the wall of the bladder, right? So that bacteria will go up through the urethra and then it gets into the bladder and it's like, hey, I can set up shop here, right? And replicate and grow and produce more E. coli. Yeah. Well, if it can't attach to the wall of the bladder, then it won't stay, right? So that's where that cranberry juice is helpful. Or getting a D-mannose in a capsule form. Drinking water is very important for this process for two reasons. One, it flushes things out, right? So the more the water that you drink on a regular basis, it keeps the bladder moving. It keeps so that bacteria doesn't set up shop along or attach to the wall of the gallbladder. It also helps to decrease the concentration of the urine as well, right? So that bacteria won't find that environment really inviting to begin to reproduce. And so we're flushing and we're diluting the urine, right? So we got to drink plenty of water, especially. Sometimes we don't think of UTIs in kids, but in the summertime, especially little girls will have a tendency to have an increased risk of UTIs if they stay in their swimsuit too long or if they're not drinking enough water. So I tell parents, make sure you're getting your kids, make sure that they're drinking water, especially in the summertime. And once they're finished swimming in the pool, take off that swimsuit. Put on shorts or something. Don't let them wear swimsuits all day. Mm-hmm. So yes, drink water. Cranberry juice or D-mannose. And then we talked about some of the preventative things, right? Don't wear thongs as often. Pay attention to the hygiene, right? Are you cleaning from front to back? Don't expose it. Taking baths, right? Making sure that you're clean before you take a bath and get into a bathtub, because then if your backside is not clean and you get into a bath, you've really just exposed, everything to E. coli because, you weren't clean to begin with. So some of those things are kind of obvious things, but I'm still seeing UTIs. And then I had another one and I lost it. Thongs, bath, cleanliness.
Soap, douches.
Oh yeah, don't do douches. Don't use soap. Right. If you suspect that you have an odor or have bacterial imbalance in the vaginal vault or within the groin area, you got to eat more green stuff, right? Chlorophyll will help to balance out the bacteria, right? There's been plenty of studies that talk about chlorophyll and body odor, because the more green stuff you eat, the more green veggies, anything that's green essentially has chlorophyll in it. That's what makes plants green, or vegetables green.
Mm-hmm.
So that increase in chlorophyll will actually change the microbiome of the body, inside and outside. So it will kill or make the environment unpleasant for those odor causing bacteria to continue to grow.
Okay.
So you can get chlorophyll supplements now, chlorophyll extracts, right? You can get chlorella in tablets. You could just eat more spinach. And I know a lot of people don't always like kale, but throw it in your smoothie, get that extra douse of green veggies. Or if you like to eat weeds, get those green weeds in to change the microbiome.
Not weed, weeds.
Weeds. Yes. Yes, so those are kind of our big things. But the reason why I wanted to bring this up is because if you're constantly getting those urinary tract infections, you're constantly getting those antibiotics to take care of them, you're just addressing the symptom, right? And unfortunately, the more antibiotic use that you have, the more damage is occurring to your overall health, right? Because it's not just taking out the bacteria that's causing the infection, you're affecting your whole body and the foundation of our health, because you're changing the bacteria within the gut as well. And so there are specific probiotics out there for women. They market them as probiotics for women for vaginal health. And I often recommend those. They're, since they are marketed towards women, it doesn't mean that men can't take them, right? Men have bacteria as well in the groin area. And so sometimes I have wives who'll say, my husband won't take this probiotic because it says women on it. I was like, they're just bugs, right? Those bugs do not discriminate.
Look, people. It says women on there because of marketing.
It's all marketing.
Because they know women will spend money.
Exactly. So making sure, that you, if you're having reoccurring issues, or if you're worried about the odor, a probiotic, it will be very, very helpful. It supports the gut health, but again, it will also support the microbiome, within the groin area. So yes, we got to love our probiotics. Let that microbiome work for you, not against you.
Right. You quit working against it.
Exactly. I wanted to bring that up, and maybe because it's summer and I don't know, maybe people are wearing swimsuits more often, but it's becoming a common question here lately.
And swimsuits is just because it's like water, or the bacteria in the water you're swimming in is now like pushed up close to your vagina.
Yeah, it's usually the moisture. It's usually the moisture that's kind of changing the pH in the environment.
Oh, okay.
And so, it's the same thing if people are constantly wearing like spandex underwear, right? Like underwear that are like that stretchy spandex, like a lot of our clothes are made out of these days. It's not cotton and it doesn't really breathe that well. Okay. But with swimsuits, because it's closer in vicinity, and that moisture has a tendency to cause the wrong bacteria to grow.
Okay.
Right? And since it's so close to the urethra, it just travels upward.
I gotcha.
Yes. Yeah. So, probiotics, drink more water, do a it's something like a D-mannose. If you're looking to address your UTI naturally, we have a ton of natural antibacterial, antibiotic type herbs out there. Most of those will work in a UTI. It's just another infection, right? Most of those will work taken orally to kind of help balance things out. But don't ignore them there, because they don't often go away on their own. And we want to prevent something turning into a kidney infection because it wasn't addressed at the beginning.
Yeah.
So, yes. All right.
Cool.
Any other questions?
Mm-mm.
All right. That's my PSA for today.
All right, friends. We'll see you guys next week.